I've had the privilege of speaking to thousands of dentists over the last 22 years. What I hear, a root cause of career satisfaction is usually not the clinical stuff. The lack of career satisfaction usually comes down to managing humans as part of your team, and humans and the unpredictability of patients and humans as a patient base, and the lack of a knowledge and a lack of a sophisticated business acumen. The average dental practice in the United States has an overhead of 68 to 72%, excluding doctor compensation. So if you add the typical 30% doctor compensation to 68 to 72%, the typical dental practice in the United States is -2 to +2% profitability. We have to go through a lot of shit and risk and liability in order to make a -2% profitability. Would you agree? Would you agree that it would probably be better to be an associate for 30% than making less than 30% as the owner of the practice because you're negative cash flow? And what people don't understand is one of the benefits of owning a dental practice is that you have a tangible asset at the end of all of it that you can sell. My pediatrician in town, all of my kids' pediatrician, and my general physician, they were married in town, and they were there for 35 years, beloved members of the community. When they decided that they wanted to retire, both of them on the same day, they had a beautiful office. You turn right, pediatric wing, you turn left, general medicine wing. They decided, this is the day, we're gonna draw a line in the sand, we're gonna close up shop after 35 years, and they closed up shop and the patients went into the ether because there's nothing to sell. There's nothing to sell in a general physician's practice and a pediatric practice because somebody can come in and open up one in an empty strip mall or an office condo, and in 3 days they'll be completely full. And by the way, the average dentist makes more than the average pediatrician and about as much as the average general physician. And I've shown this many, many times on stage. They average about 55 hours a work week. We average 32. So if you take their 10% higher average wage for a physician and break that down into hourly wage, we beat them by about 25% per hour. And most of them don't own their own their own practices. So they get taxed at the highest tax rate of 37% plus state tax. So they're usually taking home about 50% of what they make. And we do much better if we are prudent with writing off our business expenses correctly.